DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson. Thanks for joining me today. Today we're going to talk about euthanasia and necropsies, and it's something that we unfortunately have to do on our farm and ranch to relieve pain and suffering of animals and to get a proper diagnosis. Stay tuned and more after these messages.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson. Thanks for joining me today. We're going to talk about humane euthanasia and necropsy. And specifically, when we talk about humane euthanasia, that's a Latin term meaning good death. And I want to start out by talking about animals at the end of their life or the relief of suffering, which is something that as caregivers to animals that we don't want to have to do, but it's our responsibility that when those animals are not going to recover, that we relieve their pain and suffering through humane euthanasia. I heard Jan Shearer at a meeting say, when it comes to euthanasia, it's better to be a week early than to be a day late. And so the first thing that you have to consider on humane euthanasia is what type of technique you're going to use, and specifically whether we're going to use gunshot or captive bolt are our two main methods of euthanasia. Regardless of which technique you use, the location in which you will provide the gunshot or the penetrative captive bolt, there's two ways to look at this, and one of them is to look at making the X between the medial canthus of the eye and the pole, medial canthus of the eye and the pole, and where that X crosses is where the brain's located. One of the more common mistakes is that people apply the gunshot between the eyes. That'll be too low. If we're going to make that X, you'll see here in this graph that going between the eye to the pole, between the eye and the pole, will give you the X that'll show you where the brain is. Otherwise, in a paper that has been recently published from Iowa State University, you'll be able to see that instead of making the X, if you simply shoot them between the ears or apply the captive bolt between the ears, is the same location. Something that I had not seen, but something that was observed by scientists at Iowa State. This is a cross-section of a brain or a head showing where the steel goes through. If you shoot too low or shoot between the eyes, that you will be missing the brain. The brain is located up here dorsally to where this steel is located, and you can see that where it's located when you shoot between the eyes or apply the captive bolt between the eyes, that you'll hit sinus area and it will not render a kill shot. When some of the things that we've learned through the years on euthanasia studies, that if we can use a .22 rifle, but you want to use solid points. You can utilize a high-powered rifle, but understand that you will have through and through shots, and there might be some danger with 9mm or high-powered rifles of bullets entering the front and exiting the back of the head. And so you need to be very, very careful understanding that could happen. The use of a shotgun can be effective. If you want to use slugs, those are quite effective. If you want to use birdshot, use 4-shot, high brass, and you need to be close. But when it comes to euthanasia, those are some of the things. The one thing about euthanasia that I want to make sure you don't use is you don't use blunt force trauma, no sledgehammers or anything to that nature to euthanize a calf. We do not inject any substance into the vein, including air. And the last one is we do not use electrocution. Those are things you want to make sure you do not use on your farm. It's not ethical, and it will result in animal cruelty charges. When we come back, we're going to talk about doing necropsies and getting a diagnosis. You're watching DocTalk. More after these messages.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment.
Brendan Martin was raised on a beef cattle, poultry, and crop farm in Virginia. During college, he worked and interned in the cattle industry while raising his own Angus herd. As a result, he became interested in bovine reproduction and the power of genetic progress within a cattle herd. After graduation, Brendan started Valley Herd Health in Virginia, working mainly with beef and dairy cattle.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Do your cattle struggle with pink eye, BRD, or another disease? Contact Newport Laboratories for a customized solution. Our custom-made vaccines are produced using the specific diseases found in your area. These USDA licensed vaccines offer potential cost savings on vaccine and labor. Contact your veterinarian or Newport Laboratories the next time your cattle are in need of a custom solution. Newport Laboratories custom-made vaccine, because every situation is different.
This segment brought to you by the new hired hand portable cow sprayer. For more information, visit cowsprayer.com.
Hey folks, welcome back to DocTalk. Dr. Dan here. I said we're going to jump into necropsies. I lied. We're going to finish up on euthanasia. And the big thing is confirming death, because you want to make sure that you confirm death prior to doing a necropsy. When we use captive bolt and gunshot, we want to, the first thing you can do to test for death, as shown in this picture, is to look for a corneal reflex. So you'll just touch the outer surface of the eyeball. There should be no blinking or response there. And then lastly, you can confirm death by using a stethoscope and listening for heartbeat. And so those are things that or the absence of a heartbeat with these. If you do use captive bolt rather than a gunshot, the one thing I always recommend is restrain the animal. I've seen 2 catastrophic injuries of people using captive bolts and pins where the animal was down. They thought the animal couldn't move. They went to apply the captive bolt. The calf slung its head, which is quite heavy, and one of our cowboys got a compound fracture standing in the pen of the calf slinging its head when he tried to do a captive bolt. So make sure you put a rope on the head or a halter on the head and restrain that animal so that for human safety, because you have to get quite close when it comes to captive bolt. Moving on to necropsies, and you know, the necropsy is really kind of like the CSI or the coroner, where we're trying to get a diagnosis of why that animal was sick or why that animal was injured or why that animal died. And my dad, when he was in practice, said it was easier for him to sell a vaccine for a few $1,000s than it was to sell a diagnosis for a few dollars. And I think that what we have done and not looked at is when we have an abnormal death or when we have a death on our premise that could be the start of an epidemic, is getting the veterinarian out on the farm to do a proper necropsy, or doing a proper necropsy ourselves, which I've trained many producers throughout the years on large farm operations to do their own necropsies. And I think that necropsies give us an understanding of the gross pathology, which then we can take the samples, send them into the diagnostic laboratory, and get back whether it's a virology report, a bacteriology report, or some other type of ology report that will tell us or give us the understanding of why the animals died. So We're going to kind of go stepwise through a necropsy, what I'm looking for specifically on a bovine, feedlot calf, and explain that. When we do the necropsy, the first thing we'll do is we'll lay the animal with its left side down. And there's two reasons for that. The first one is it puts the rumen on the downside and gets that out of our way. And the other one is, when we're talking about bovine respiratory disease, when we have a lesion, it's going to show up on the right side, because on the right side of the carcass, or the right side of the animal, we have two bronchus to go into the lungs, the right cranial bronchus and the right caudal bronchus. And the first lobe of the lung, because of gravity that will show bovine respiratory disease, will be that right cranial lung lobe. So we want the right cranial lung lobe up, and we want the rumen down. So we're going to start out, we got the animal laid out, so if you have a veterinarian come out, you can be one step ahead of them, have the animal with the left side down. When we come back from the messages, we're going to go ahead and get started opening up this carcass. We'll walk stepwise through some of the different systems and some of the things we look for. You're watching DocTalk. More after these messages.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica Inc.
Howdy, I'm Kurt Pate with the Tip of the Day. We deal with a lot of bulls around this place, and we get along with them pretty good because we work them a lot. And if you work them properly and move them quite a bit, the fighting will reduce, and every time you move them, they learn to take pressure, and then when you start to work with them, they don't start fighting each other.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
It takes vision, dedication, hard work. It takes knowing who you can trust. At AdPro Corporation, we have more industry-endorsed research behind our trace minerals than any other company. Proof that our patented performance minerals help improve overall animal health and performance. Lots of companies make claims. At AdPro, we generate results.
If my calves start healthy and stay healthy, I've got a good shot at making money. That is why I trust Colostrum. It gives my calves the protection they need until their own immune systems kick in.
Calf raisers trust Colostrum colostrum supplements. Colostrum is USDA licensed and proven effective. When your money is on the line, trust Colostrum.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. Dr. Dan here, and we're talking about necropsies. And as I said, we need to put the animal on the left side. I need to back up one step. We need to have a good clinical history ready for the veterinarian. So what was the clinical signs the animal was exhibiting, and how was the animal treated? That's very, very important, whether it's an animal case that's live or whether it's an animal case for necropsy. The other thing is we need to make sure that we have an animal that is of adequate quality, meaning not autolyzed, especially in the summer. We can't have a rotten carcass. Will yield no results from doing the necropsy. So we have the animal there. We have a clinical case diagnosis or definition of what we've done, the history. We have an animal that is proper for doing the necropsy, and we have it left side down. The first thing I'm going to do is remove the pluck, which is the tongue, esophagus, trachea, heart, and lungs. And I will first start out by looking for BVD, persistently infected mucosal disease, which shows up on the tongue, in the esophagus, anywhere from the lips to the anus is where we'll see these ulcers if we have a BVD PI that has suffered from mucosal disease. And these erosions will be on the tongue, in the esophagus, in the abomasum, small intestine. So it's the first thing that I'll look for, and you can see from these pictures what what a normal, nice, white, shiny esophagus looks like versus one that has erosions from BVD. The next thing I'll do is I will look at the pharynx. Pharynx is where we have both the digestive and the respiratory tract meet at the back of the throat. Here we can have balling gun issues. If someone is overzealous with applying the balling gun or a speculum, we can actually have that protrude out the side of the mucosal surface of the pharynx. Be very, very careful when placing these balling guns. The next one is I will open up the larynx, which is the voice box or the mooer of the cow. It should be white and shiny and not have any erosions. If we have calf diphtheria, which can be caused by Fusobacterium necrophorum, which also causes foot rot and liver abscesses, I might see some sort of lesions. This is usually in lighter weight calves. But the real thing that I'm looking for at this point in time as I open up the trachea is looking for infectious bovine rhinotracheitis, which is the pathognomonic, which is otherwise known as IBR. IBR, we don't see it very often. The vaccines that we have are quite effective, but when we do see it, it is a pathognomonic lesion of this white fibrinonecrotic exudate or cheesy substance on the inside of this trachea that isn't scraped off easily by my knife. You can see that is, if you see those lesions in that trachea, you can bet your bottom dollar that you have IBR on your farm. The next thing I'm going to do is examine the lungs, and the lungs have a lot of pathology, and so I'm not going to go through all of them, but the first one is going to be bronchopneumonia, okay, or BRD, and this will be shown in the is a cranial ventral presentation, meaning towards the front of the lungs and to the bottom of the lungs because of gravity, okay? So the bottom of the lungs and the front is where we'll see the dark red areas of consolidation, and these are heavy, these are thick, these are not squishy, they're hard areas of the lung. Normal lung would be pink. It will be like grabbing a bag full of marshmallows type of feeling and spongy. So you can see the difference right away here in this picture is the dark area is what bronchopneumonia looks like, and the top area is normal lung. So when we come back, we're going to talk a little bit more about necropsies. We'll examine more of the lung, and we'll talk about some of the other body systems.
Did you know long-range planning through the checkoff can help keep your business profitable? To successfully pass on cattle operations from one generation to the next, it's important to promote beef and keep farms and ranches profitable. Your beef checkoff helps do that.
I'm Will Townsend. I'm part of Townsend Ranch. It's a ranch my grandparents started. They actually raised their family and started growing their cow herd right here. I would be the third generation on the ranch, and daughter and expecting a son would be the fourth generation on the ranch. The beef checkoff has done a lot of things for the beef industry. The biggest thing, when you look at it from a 30,000 foot view, is that it's brought a lot of different segments together to promote beef. And I don't think that is done easily. I think that's a very big feat.
And when the checkoff dollar is collected, the money is spent for educational purposes. A lot of them are national programs, and the state takes the national programs and runs with them. So not only do our own local producers benefit from that, but nationally.
Yes, I really like the research and development aspect of the beef checkoff. Adding value and development of new products, new beef cuts, things like the flat iron steak. That's a huge deal, again, that with a segmented industry probably wouldn't have been done without the beef checkoff. And then both domestic and foreign marketing is something that really probably wouldn't be done by different segments of the industry without them all coming together. Again, that probably wouldn't have been done without the beef checkoff.
And I don't know who would promote our product if we who are raising it don't promote it ourselves.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net.
Still using ineffective fly tags on your cattle? It's time to eliminate fleas, ticks, flies, lice, and parasites, and at the same time, give them a shiny coat, making them more valuable. One fly tag can cost $2.50, but you can do this all for about a nickel a head. Introducing the Cow Sprayer, designed and built in the U.S. The Cow Sprayer is portable, solar-powered, and comes with a 25 or 40-gallon tank. Eliminate parasites for about 5 cents a head with the Cow Sprayer. Cowsprayer.com.
It's easy to spot the man who uses Synanthic. With lower volume and less waste, Synanthic steps up your deworming routine. Get more deworming with less dewormer at Synanthic.com.
Beringer Ingelheim Vetmedica Inc. knows the importance of beef quality assurance and asks you to step up and get certified. Go to bqa.org for details.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey, welcome back to DocTalk. Dr. Dan Thompson here. We're talking about doing a necropsy of the bovine animal. And when we look at the lungs, the first thing we're going to look for is the bovine respiratory disease. Other things that we'll look for if we have over-enlarged lungs that are really wet and heavy coming out of a summertime heifer that's been on feed for a long number of days, we'll see what we call atypical interstitial pneumonia. And these lungs are very heavy to pick up out of the rib cage. But when we look at lung pathology, we're looking to see if the lungs were normal. We're looking to see if we have respiratory disease, whether it's BRD or AIP or something of that nature. The heart should be heart-shaped. If the heart is apple-shaped or enlarged, we may have some sort of right heart failure or some sort of congestive heart failure that can be indicative. We've had high-altitude disease in cattle, okay? So really when you look at the heart, you're just looking to see if it's normal-shaped, if it's enlarged, or if it's round. And so when we move into the other areas of the body, the liver should be dark liver colored, and we're looking for sharp edges. We'll also look to see if there are liver abscesses that are present at that point in time, but it really doesn't talk about the pathology of why that animal was sick. I'll also look at the kidney. The kidney at that point in time should be one color. It should be not pulpy when we open up and look at the pelvis of the kidney. Indicating whether or not we had some sort of endotoxemia or endotoxin death. But for the most part, we don't see a lot of kidney disorders in feeder cattle, okay? And then the last place that we'll look is we'll find the cecum. I'll open up the cecum. I will look for blood in the cecum, which could be indicative of coccidiosis. And then the small intestine, if it's baby calves with scours, we'll look for salmonella. We may look for E. coli scours, take sections of the gut, and move those down the line. But for the most part, our pathology is going to occur in that respiratory tract. It's going to occur with the heart and lungs. We'll also look for opportunities with the liver disease, with kidney disease, with the intestines. But for the most part, the big thing is to make sure that you get your veterinarian out on the farm, understand what the clinical signs are that will guide him or her to the point in time where they can take the proper samples to get the proper diagnosis. It's very difficult to diagnose lameness post-death, and also it's very difficult to diagnose central nervous system disorders. So if we have that clinical history there, and you said this animal was found morbid or down, which means it probably has some sort of central nervous system or has the potential to have some central nervous system disorder, we want to make sure that you will tell us that, and we will remove the brain or remove the head. If there's any time that you think that there's something zoonotic, which meaning that animals could transfer it to you from themselves, animal to human transmission, make sure that you wear Band-Aids when you do necropsies. Make sure that you wear eye protection when you do necropsies. And if you're going to go out, do a necropsy, make sure you wash your hands. Make sure that you wash your clothes. Do not expose children or people that are immunodeficient at that point in time to these potential diseases. Necropsies are a great tool, and it's something that I think that you need to make sure that you get a veterinarian on your farm. Always work with your local veterinarian. You're watching DocTalk today. I appreciate you watching us. If you want to know more about what we do here, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thompson. Thanks for joining us today, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.